Are white matter lesions a cause of vascular dementia? Imagine your brain as a busy city with roads and highways connecting different neighborhoods. When those roads get damaged or blocked, traffic slows down or stops, causing problems. White matter lesions are like potholes or roadblocks in the brain's white matter, which is made up of nerve fibers that help different parts of the brain communicate. These lesions are often seen on MRI scans and are closely linked to vascular dementia, a type of dementia caused by problems with blood flow in the brain. White matter lesions usually happen because of small vessel disease, which affects the tiny blood vessels supplying the white matter. When these vessels are damaged, blood flow decreases, and brain cells in those areas can become injured or die. This damage disrupts the signals between different parts of the brain, leading to cognitive issues like memory problems, difficulty solving problems, and trouble with balance. These changes happen gradually and may not cause obvious symptoms at first, but over time, they can significantly impact mental function. Research shows that white matter lesions are common in older adults and are a major feature of subcortical ischemic vascular dementia, a subtype of vascular dementia. They often occur alongside small strokes called lacunar infarcts, which are tiny areas of dead tissue caused by blocked blood flow. The accumulation of these tiny injuries over time weakens the brain's connections, leading to the cognitive decline seen in vascular dementia. The process behind this involves repeated small injuries or strokes that often go unnoticed because they don't cause immediate symptoms. These microvascular insults cause damage to the white matter, which is essential for connecting different brain regions. When these connections are lost, functions like memory, reasoning, and coordination become impaired. This gradual damage explains why some people develop dementia without experiencing major strokes or obvious brain injuries. While white matter lesions are strongly associated with vascular dementia, they are also seen in other conditions like Alzheimer's disease. However, in vascular dementia, the primary cause is related to blood vessel problems and ischemia, or lack of blood supply. Managing risk factors such as high blood pressure, diabetes, and smoking can help prevent or slow the progression of white matter damage. Regular brain scans and monitoring are useful for early detection, especially in people at higher risk for stroke or vascular problems. In summary, white matter lesions are not just markers but also a cause of vascular dementia. They reflected underlying small vessel disease and repeated microvascular injuries that impair the brain's communication pathways. Protecting blood vessel health through lifestyle changes and medical management is key to reducing the risk of white matter damage and subsequent cognitive decline. Always consult healthcare professionals for personalized advice, as individual risk factors and health conditions vary. Understanding this connection helps us focus on prevention and early intervention to maintain brain health and wellness.